Dear doctor, dear resident physician, this is my request to you. Please dismiss the med student if you don't need them. Please dismiss the med student if they've been working for 12 hours, if it's 2 a.m., if you know there's 3-4 hours of downtime coming up. You know, as a med student, I've spent a week of OB nights, maybe for 2 or 3 emergency C-sections with nothing else to do. I don't really know that it was that productive, but I had to do it because I was a med student. My time, my health, and my education were in the hands of residents. So I'll just tell you, for me, you know, when I was on nights, as soon as I saw the med student, as soon as I knew who the med student was that was assigned to work with me that day, I gave them the option, hey, you're free to go home. If they wanted to stay, I'm not stopping them from staying. I'm not stopping them from coming in on their day off and working with me. They know I'm on 6 days a week. I'm not stopping them from going to OR on Christmas. But I'm going to give them the option. Hey, you know, if your surgery is not your passion, you don't have to stay up all night with me. I don't need you. I'm happy to teach, but I don't need you. I don't need you to write my notes for me. And I can pop a note in 2 seconds. I don't need you to see consults for me. I have to do that anyways. So this is my appeal to you. Empower the med student. You know, I also tell them when they're on day shift with me and they have the assigned cases, I tell them, hey, in between cases, feel free to help me. Feel free to come chat with me, but feel free to study. Feel free to use your time. Make sure you eat lunch. Make sure you pee. You're allowed to breathe. You're allowed to have respite. You're allowed to enjoy yourself. You're allowed to go talk with other services if you're interested in a different specialty. I don't partake in the culture of, you know, you have to be here because you're assigned here, even if there's no work, and you just have to be ready to work. No. There's times where a med student has shown enthusiasm, and I'm happy to take them along to do post-op checks, you know, cut sutures out, remove staples, etc., and to teach them and to ask them questions. But this is my appeal to you, you know, dear resident. If the med student's there and you know they've been on for 12 hours or they've had a long case, let them go. Let them enjoy themselves. They're already in the system. They're going to match in a year or in 2 years. And they're going to work up to the limit of their duty hours during residency. I believe that the medical school curriculum and the hours of a med student should not be that of a resident and should not be close to that of a resident. Of course, there's a whole discussion of resident duty hours, and you know, you guys know if you're residents, but we have the power as residents to free up med students, to unshackle them, to untether them from the hospital, and allow them some respite, some enjoyment of life, you know, outside. Allow them to continue their hobbies, allow them to spend time with their families, allow them to study. And we know that as residents, they're not going to have that luxury. So I think it's our duty to provide that to them as much as possible. I'm not saying take away learning, but I'm saying 6 days a week, that's not learning for a med student. 24-hour call, that's not learning for a med student. That's what I believe.